Hello, how you're doing? My name is Ed, a junior doctor in the UK, and on this channel we like to break down the medical science of TV and film, a show that doesn't need too much breaking down from a medical point of view because it handles it so well. This is Going to Hurt, and I've already covered the first episode, and boy, did it live up to its name. So we're going to be checking out episode 2. Again, viewer's discretion, as this is set on a labour ward, so we're going to see babies being born, operations, and potentially some very unsettling scenes.
I'm not telling you how to do your job, doctor, but if we can't find the swab, shouldn't we...
I'm sorry, I thought you weren't telling me how to do my job.
Okay, everybody, can you just check in your shoes just in case it's fallen in there?
So I've totally been part of this process before. We couldn't account for a swab, and so we had to recheck everything. What doesn't make it easier is that once swabs are soaked in blood, they can be really difficult to find them in the surgical field. In operations, we use a lot of equipment, so we have to be meticulous about counting everything that is used to make sure we have it all at the end. And that usually involves one of the scrub nurses having a tally on a big whiteboard, counting everything out and in. In the unlikely event, but not impossible event that this fails and the swab is left inside the patient, then surgical swabs have a small band sewn into them so that they'll appear on an x-ray.
No. If you remember, you misdiagnosed his mother, so he was delivered about 15 weeks too early.
No, I meant, did you repeat the bloods?
You've done your bit, mate. We're doing ours now.
This is a bit of a running theme in the show so far, so people not treating their colleagues very nicely. As I said in the first episode, this may have happened and be realistic, but it certainly isn't representative. If you told a colleague that you delivered a baby early, they wouldn't berate you for the mistake. They're going to be a little bit more empathetic, as they've made mistakes too. And secondly, you'd at least give them more of an idea of what was happening with the patient. One thought could be that this is a comment on the pressure cooker environment that the hospital is. So colleagues that, could be friends are put in an environment that they end up treating each other poorly.
Doesn't mean that we're bad at our jobs. If we learn from them, they're what makes us better.
All right, Gandhi, it was a fucking lost swab.
Not that. The mistake you were visiting in there.
Oh yeah, so this is more the type of thing you'd get off colleagues. And okay, everyone knows this advice, but man, sometimes you just really need to hear it again at the right time. We then see a scene of Adam after a shift, and I know everyone is different, but being up strange hours and unwinding, something I can definitely relate to. Even after a night shift, I can get in and feel wired and not be able to sleep. And in that time, I feel like I've earned an excuse not to do anything productive, but simultaneously I feel too impatient to even watch Netflix. So I normally just chill out, noodle around on guitar, and watch some YouTube. Hashtag not sponsored. And like we see here, sometimes after some really rough shifts, I just like some quiet time to listen to some music, maybe have a bath, and just turn the lights out and chill for a bit. And I'm well aware how equally indulgent and depressing that sounds. And we see Dr. Adam is having flashbacks from the mistake which led to the emergency C-section of the 25-week-old baby from the last episode. And I don't even feel comfortable showing the flashback clip in this video, and that's just a clip which we know isn't real. Imagine these doctors and midwives actually go through this trauma and carry it with them. I think we are talking about healthcare professionals' mental health more, particularly because of the pandemic, and Adam Kay himself has been a huge advocate for that, but I don't think we're really making any meaningful difference. In my opinion, we need to be dealing with the main issue of burnout and moral injury of not being able to provide the best care for the patient in front of you because of stretched resources.
You look like you haven't slept.
No, I've had to cut sleeping out. It's an unnecessary distraction from these exams.
When are they?
A few weeks.
Oh, Dr. Shruti, the SHO, I feel your pain. Something I just didn't appreciate when I was at medical school was the amount of exams you have to do after qualifying. So not only do you have to do this demanding job, you also have to do exams most years and mandatory training courses, most of which you have to pay yourself. So it can be a real grind. I'm also well aware that lots of jobs are like this before anyone comes at me to claim that I'm being all woe is me about medicine.
Right. How bad's the pain on a scale of 0 to 10, where 0 is no pain at all and 10 is sawing your own leg off while listening to Michael Bublé?
Let's say 3.
If I had £1 for every time I asked that question, and I don't mean the leg sawing Michael Bublé bit.
3.
Chopping chilies and rubbing your eyes.
That's what I mean. That's clearly an 8.
The patient's partner highlights the difficulty of interpreting this because people's experience of pain is very different. You also get a huge number of patients that say they have a high pain threshold. So it's not perfect, but it does give you a pretty good idea.
She's in significant pain when I examine her, all pointing to ovarian torsion.
Ultrasound.
A&E did an ultrasound which was normal, but obviously that doesn't exclude...
Do you normally operate on patients with period pains?
It's really not period pains.
Dr. Adam is concerned the patient he's just seen may have an ovarian torsion. So this is where the ovary twists, and this may block off the blood supply to the ovary. So exactly as they've described here, it's an emergency because this can starve the ovary of blood supply and make it go necrotic, basically mean the tissue ends up dying.
Home. Now.
Well, what if it is ovarian torsion?
Send her home. There's a good boy.
Although not happened to me with this particular emergency, I have had advice from seniors that I've not been happy with, and you can feel pressurized in discharging patients against what you think. And this really is a balance. You have to be both an advocate for the patient and also trust your seniors. But to do this, you have to make sure your senior is aware of your concerns, and either they should be able to justify their decision based on what you've presented, or you should kindly insist that they review the patient themselves. And let's face it, most of the time your senior is right after reviewing the patient. But one memorable time for me when I was right, I was given advice to send home a patient with epigastric pain on some pain relief as they had normal observations, largely normal bloods and a normal chest x-ray. I wasn't happy given the plan, so I asked the surgical team to review. That patient had a perforated duodenum and had emergency surgery within hours and then a 4-month stay on ICU. So sending them home probably would have killed them. But as I say, on reflection, I should have been able to better communicate my concerns with my senior in order to get the result I thought the patient needed.
Who's up first then?
The MOB in bed 17.
MOB?
مش بلوبة. That's a good one.
Okay, we saw a bit of this in the first episode. I just don't understand why they have this disparaging language about patients. The book really wasn't this mean, or maybe I just read it in a different tone. As I said, you may occasionally hear this, so it's not untruthful, but the frequency just makes it unrealistic.
I've had a look and they're all normal.
Why have you done this?
What?
Welded a laptop to a Zimmer frame?
No, they've replaced all the ward computers with computers on wheels.
Computers on wheels. We all know them so well. And the resulting acronym COW really doesn't help this perception of disparaging language being used on the ward, because you can find yourself shouting down the corridor, has anyone seen the cow? And this system we see here, this horrible blue background with the yellow and white text, is 100% the system I first used as a doctor in 2015, which was a blooming shock to me because before medicine, I was a computer programmer. So I thought the 5 years I was at med school, computer programs would actually get better. And then I was using this system. I thought I'd gone in a time machine.
She had a normal ECG and normal bloods. My 10-year-old could have told you that.
All I can do is apologise.
What's your name?
Shruti. Acharya.
I'll be writing to your consultant, Shruti.
Oh my God. I mean, that conversation is just way too close to the bone for me. It is the exact conversation that a specialty registrar was having with me just last week.
And to get down to ground level, he slides down a lamppost, koala bear style, and he finds himself in A&E with severe grazing to both hands and a complete degloving of his penis.
Yeah, I mean, this looks very familiar. I have a fair few stories very much like this, and clearly you have to anonymize things you say, even to the point of changing major things, as often details can be fairly unique. But I think what we do has such a shared interest that it's only natural to talk about what we see. Maybe not in between a starter and a main course though. As doctors online producing content, which this show falls into a weird grey area as Adam K is a retired doctor. We do have to be careful about what we say and how we say it. It's one thing sharing a story with a friend, but quite another to look like we're using others' misfortune to entertain people. The main theme in this episode is Dr. Adam struggling to cope with his mistake. We saw this early on with the flashback scenes, but we go on to see how this mental trauma manifests and starts to have a huge negative impact on his life and the people around him. And he doesn't feel like he can share what he's going through. Sadly, a story I've heard a lot from colleagues.
And there's no way you can tell me what it is?
Oh, no, I want it to be a surprise for Carl.
We're always surprising each other.
Yeah.
That's 10 points to anyone who guessed Kinder Egg.
Whew! I can confirm as the Gynae SHO that one of my tasks was to remove foreign bodies from vaginas. It's an important job. Patients are often scared and humiliated when these things happen. So this depiction of patients somewhat pleased with themselves is not accurate in my experience. And as a junior, managing this well is sort of a rite of passage, if that's an appropriate phrase.
Carl Markham, will you marry me?
What? Having said I've taken a lot of foreign bodies out of vaginas before, I've never had a wedding ring, Kinder Egg container, vagina retrieval proposal before. I actually suspect that no one has seen this and it's just an exaggeration of reality. I have removed similar foreign bodies before though, and this round shape actually makes it quite hard to retrieve because you have to get the forceps clamps right beyond the round bit so they don't slip off, and that can mean you can accidentally clamp a bit of the vaginal wall against the object, making it hard to get out. So respect for getting this one out so easily. So all in all, a job well done. We then see yet another flawless surgical scene. In the first episode, we saw obstetric operations, so a few C-sections, and this time we will be in different theatres seeing a gynae case. And what we're seeing here is a laparoscopic approach, sometimes nicknamed keyhole surgery, so using small portholes in which to pass the camera and instruments into the abdomen. We also blow gas into the abdomen to give us some room to maneuver, and this is quite a skill to operate these long instruments while just using the video feed from the camera. In this conclusion to the story arc, we find out that Dr. Adam was right to suspect ovarian torsion in this patient, despite advice from his seniors to discharge her. So there you have it, another terrific piece of TV. As with the first episode, the medicine, the sets, the communication issues, coping with failure, all very familiar to me. Just once again, everything feels a little bit meaner than I can relate to, but we are seeing it through the protagonist's eyes, who is becoming burnt out. So maybe this darker tone is just the way he's viewing things. As always, I would love to know your thoughts on this episode and the show in general, so please drop me a comment, and why not give this video a like and subscribe to the channel if you haven't already. Also, did you notice my jumper? Oh god, this is embarrassing. I saw it in my wardrobe earlier and I thought, you know what, it looks just like the one he wore in the first episode. I might just wear it, see if anyone noticed. Did you? If you did, you've won today. So on that random note, I hope you're all well, and I'll be back soon.